Good evening, ladies and gentlemen. Today I'll be discussing spinal cord injuries, or the shorter name SCI, for this presentation. I'll also be discussing the causes, signs and symptoms, risk factors, diagnosis and treatment, complications, and prevention for SCI. SCI is when any part of the spinal cord or the spinal cord nerves are damaged. There are two types of spinal cord injuries, complete or incomplete. According to an article on the Cleveland Clinic website, a complete injury causes total paralysis or loss of function below the level of injury. It affects both sides of the body. A complete injury may cause paralysis of all four limbs, known as quadriplegia, or the lower half of the body, known as paraplegia. As for an incomplete injury, some function remains on one or both sides of the body. The body and brain can still communicate along certain pathways. Complete spinal cord injuries are permanent, but with an incomplete spinal cord injury, the patient does have a chance of gaining some function back after time in rehabilitation. Per an article on the Mayo Clinic website, your ability to control your limbs after a spinal cord injury depends on two factors: where the injury occurred on your spinal cord and the severity of the injury. The lowest part of the spinal cord that is undamaged is what doctors refer to as the neurological level of injury. This is what will determine if your injury is complete or incomplete. According to the National Center for Biotechnology Information, states the most common causes of spinal cord injury is motor vehicle accidents at 31.5%, followed by falls at 25.3%, gunshot wounds at 10.4%, motorcycle crashes at 6.8%, diving accidents at 4.7%, and medical surgical incidents at 4.3%, which in whole counts for 83.1% of total SCIs since 2005. Summarizing the article, Spinal Cord Injury by Mayo Clinic, SCI can result from damage to the vertebrae, ligaments, or discs of the spinal column or to the spinal cord itself. A traumatic spinal cord injury is caused from a blow to the back or neck that fractures, dislocates, or compresses your vertebrae, or it is caused from a penetrating wound. Although this is an acute wound, it can take days for the entire spinal cord injury to be complete. Due to the swelling, inflammation, bleeding, and fluid accumulation that is gathered around the spinal cord, a non-traumatic spinal cord is caused by arthritis, degenerative disc disease, cancer, or inflammation within the body. Mayo Clinic states that some emergent signs and symptoms include extreme back pain, pressure in your neck, head, or back, weakness or incoordination in any part of your body, numbness and tingling in your hands, fingers, feet, and toes, loss of bowel and bladder function, impaired breathing after an injury, and an oddly positioned or twisted neck or back. Other symptoms that occur following a spinal cord injury include hyperreflexia and muscle spasms, changes in sexual function and fertility, and difficulty breathing or maintaining an open airway due to inability to expel secretions in the lungs and esophagus. Per the Mayo Clinic article on spinal cord injuries, risk factors that are common in spinal cord injuries include the male gender, the ages of 16 to 30, and then 65 years and up, alcohol use, engaging in risky behavior, and having certain diagnoses. The age range of 16 to 30 is stated to be more than half of spinal cord injuries that occur, as well as 65 and older due to the increased risk of falls. Alcohol use is said to make up 25% of traumatic spinal cord injuries per the Mayo Clinic, which is where risky behavior also comes into play. Driving under the influence, swimming or driving while intoxicated, and not wearing proper safety equipment is the major causes of spinal cord injury for those younger than 65. Certain diseases, such as osteoporosis or other bone or joint disorders, increases your chances of obtaining a spinal cord injury. Diagnosis of spinal injury is fairly clear-cut. According to an article on spinal cord injury by the Cleveland Clinic staff, providers will perform a neuro exam to determine motor function and sensation. CTs, MRIs, and X-rays are utilized to see the damage of the bones, soft tissues, and spinal cord blood vessel damage, and even if there are blood clots within the body. Treatment for spinal cord injury begins as soon as possible, which is normally as soon as an accident occurs. The first thing that someone is to do while on scene of an accident is to stabilize the neck with a C-collar. or if you don't have one, do not move the patient. Moving the patient can cause further damage. The next, just as equally important step is to make sure that the patient's breathing. And if they aren't, you need to maintain an open airway for them. Once the ambulance has arrived and the medical personnel will take measures to prevent shock. There's a team of multidisciplinary members that will be assisting in the plan of care for the best possible treatment plan for the patient. Surgery may be needed to remove bone fragments or shrapnel. Meds will be provided, immobilization such as traction to realign the spine or soft neck collars, and even using experimental procedures that help prevent cell death, such as medical-induced hypothermia for 24 to 48 hours, although more studies are needed for this experiment to ensure its hypothesis. According to Mayo Clinic, the interdisciplinary teams consist of orthopedic surgeons, neurosurgeons, psychologists, nurses, physical therapists, social workers, SCI experts, and could even include cardiologists and pulmonologists, depending on the extent of the injury. There will be lifelong care for those with spinal cord injuries. After the acute phase of treatment is finished, there will be continuous care that consists of treating secondary problems such as pressure ulcers, deconditioning, failure to thrive, muscle wasting, respiratory illnesses, blood clots, muscle spasms, and the mental issues that one may face with their new way of life. Rehabilitation will consist of physical and occupational therapy to help with muscle strengthening, motor function skills, and ways to adapt to their new life. There is a lot of patient and family education during this phase of treatment. The patient will be educated on how to prevent complications from SCIs, how to utilize equipment that's provided to them, and how to continue to live life normally. Healthcare workers encourage those that have a spinal cord injury to continue participating in their favorite activities and hobbies, as well as continuing with work and school. There will be education on medication regimens that will help with muscle spasms, bowel and bladder control, and even sexual function. It's important for the family and patient to realize that it is normal to go through the grieving process, and that the family needs to be there for their loved one more than ever. Family and individual counseling would be beneficial, and knowing the signs and symptoms of suicidal ideation is encouraged. After living with a diagnosis of spinal cord injury, there are complications that can arise. It's important as a healthcare professional to educate on the signs and symptoms of said complications to prevent adverse effects from occurring. Some of the most common complications that occur after spinal cord injury consist of bowel and bladder control that is altered. Due to the spinal cord injury, the messengers that send signals to your brain to inform you that you need to urinate no longer work. This causes the patient to have urine setting in the bladder for prolonged periods of time, which increases the chance of urinary tract infections and autonomic dysreflexia, which is a life-threatening complication. The bowels will still work, but due to the inability to move around like before, the bowels become slow, which causes constipation. A high-fiber diet and med regimen will aid in this complication. Pressure ulcers are another common complication of SCI. If the patient's able to, have them change positions frequently, or have their caregiver change positions for them at least every 2 hours to prevent pressure sores. Changes in the circulatory system also happen. There could be orthostatic hypotension, swelling in the lower extremities, hypertension, which can also lead to autonomic dysreflexia, and the potential to develop blood clots throughout the body. There may be issues with the respiratory system depending on the extent of the injury. These particular complications consist of the inability to productively cough and deep breathe, which in turn can cause pneumonia and other respiratory illnesses. It's important to educate on signs and symptoms of infection. Bone and joint issues may cause further complications such as muscle spasms and even osteoporosis. Patients with SCI are more apt to either lose weight and atrophy, or they live a sedentary lifestyle, which puts them at increased risk for obesity and cardiovascular disease. Pain can occur for those that have SCI, especially in those with an incomplete SCI. Prevention is another topic that needs to be discussed, especially among the high school and college ages. Prevention consists of safe driving precautions, don't drink and drive, put your phone down, don't get distracted while you're driving, and most importantly, wear your seatbelt. If you're swimming, know the depth of the water before you dive in. If you intend on diving, you need to make sure it's at least 12 feet deep per the Mayo Clinic. If you're active in sports, use proper safety equipment. Listen to safety coaches when they're teaching you how to protect your head in contact sports. And lastly, prevent falls, especially for the elderly. Use non-skid shoes even when you're in the house. Avoid rugs or make sure that they have a non-slip backside. And insert handrails in the bathroom and stairways. In conclusion of today's presentation, I would like for you guys in the audience to know that spinal cord injuries aren't always preventable, but taking precautions will slim the chances of one occurring. Using safety precautions and making good choices will help prevent obtaining an SCI. Knowing the complications after an SCI, the diagnosis and the treatment is pertinent for those of healthcare profession and those in the audience that care for someone with an SCI. Thank you for your time.